What is the difference between the NIH Stroke Scale and the Barthel Index? When it comes to stroke care, two important tools often come up: the National Institutes of Health Stroke Scale and the Barthel Index. While both are used in the context of stroke, they serve different purposes and focus on different aspects of recovery. The National Institutes of Health Stroke Scale, often abbreviated as NIH Stroke Scale, is primarily a neurologic impairment scale. It assesses the severity of neurological deficits caused by a stroke. This scale evaluates functions like consciousness, vision, motor skills, sensation, language, and attention. It is mainly used during the acute phase of a stroke to quantify initial neurological impairment and to monitor changes over time. On the other hand, the Barthel Index measures a patient's ability to perform activities of daily living, often referred to as ADLs. These include essential tasks like feeding, bathing, dressing, toileting, and mobility. The focus here is on functional independence and disability rather than on neurological deficits. The Barthel Index is commonly used in rehabilitation settings to assess recovery progress and determine the level of assistance a patient may need. Now let's talk about scoring. The NIH Stroke Scale consists of 11 items, each scored based on the function tested. The total score can range from 0, indicating no stroke symptoms, to 42, which reflects the most severe stroke. Higher scores indicate greater neurological impairment. In contrast, the Barthel Index uses an ordinal scale to score 10 ADL items. Each item can score 0 for enable, 1 for needing assistance, or 2 for being independent. The scores are summed and multiplied to give a total score out of 100. This score reflects the degree of dependency, with lower scores indicating higher levels of dependency. In terms of clinical use, the NIH Stroke Scale is more sensitive to neurological changes. It is often utilized in clinical trials and acute stroke management to detect small but clinically significant changes in a patient's neurological status. This sensitivity allows for smaller sample sizes in research studies. Conversely, the Barthel Index is less sensitive to minor neurological changes, but provides valuable insights into how a stroke affects daily functioning and independence. It plays a crucial role in guiding rehabilitation goals and discharge planning. Timing is also important when considering these scales. The NIH Stroke Scale is typically administered in the acute hospital setting, often by neurologists or trained healthcare professionals. It assesses stroke severity upon admission and tracks early recovery or deterioration. The Barthel Index, however, is used throughout the rehabilitation phase and sometimes in long-term follow-up to evaluate functional outcomes and the need for assistance in daily activities. In summary, the National Institutes of Health Stroke Scale quantifies the severity of neurological impairment shortly after stroke onset, focusing on specific neurologic functions. In contrast, the Barthel Index assesses the impact of stroke on daily living activities and overall functional independence during recovery. Both scales complement each other in stroke management, with the NIH Stroke Scale guiding acute treatment decisions and the Barthel Index informing rehabilitation and long-term care planning. Always remember, if you have questions about stroke or recovery, it is best to consult a healthcare professional for personalized advice.